My name is Tony Goodman. I'm the head of health training institutions and also the spokesperson for the Ministry of Health. So, free primary health care is a new initiative being introduced by the Ministry of Health to get all persons living everywhere in Ghana to access primary health care at the CHIPS compound level, the health center level, and the polyclinic level. And we've also are in the process of constructing health kiosks across populated places of the country to give people a basic health care. This basic health care will include diarrhea, malaria, respiratory diseases, and any other basic um, illnesses that our people go to these facilities to access. That is for the preventive. Another promotive, which we already do for some programs like the immunization, visit of the home, trying to prevent diseases. Like during the COVID, you remember we tried to vaccinate. So you now have a structure that takes care of that. Remember during the COVID era, it was chaotic. We didn't know what we were going to do. So to have a structured promotion system. So moving away from health, sick care to health care. You are taking care of the people already. You don't wait for them to get sick before you take care of them. We're also doing this because about 43 to 45% of Ghanaians die annually because of non-communicable diseases. And if you want to deal with non-communicable diseases, what you should be doing is to let people know their health status. You counsel them, you guide them, you take them through screening periodically and advise. When we did the study, we realized that there are people who even know that they have some conditions already, but for the fact that they are busy or do not have money, they don't go to hospital. That is why we are taking the health care to the people. If you are in a hospital, you are in a market, you are around a lorry park selling, we will still come to you and help you take care of your health needs. We are doing this to reduce the no bed syndrome, where Ghanaians are rushed in ambulance because they have crisis, where people are rushed to hospital because they have crisis. And then you get to the hospital, they tell you that there is no bed. We are doing all of these to make sure that every Ghanaian is healthy. You are not rushed to hospital. You know your health status. You know what to eat, what not to eat, what to go through when it comes to mental health. Because we are going to also counsel people regarding mental health. There are a lot of people who have issues in terms of how to deal with their mental health issues, menstrual cycle issues, where how to take care of even their reproductive health issues. These are things we want to do. If you are an institution and you know the problems of your people, you take pragmatic measures to deal with them, not to allow it to degenerate into catastrophic situation, what we call in health catastrophic, because you would be spending on them until you run out of money. You won't have any money to take care of yourself and your family. So what we are doing is to protect the people, make sure that Ghanaians are safe. We don't have continuously have people dying because they have non-communicable disease. So this is, in a nutshell, what we call free primary health care, what we seek to do. So these are makeshift kiosks we want to put at areas where we have like the marketplaces, like lorry parks, where we think people stand in the morning to go to even pick car and go to work. We want to be there, position that kiosk. It has a consulting room, it has a washroom there, it has a delivery area or a line in area, it has where we keep medication. So that when you go in there, you need to be given some minimal medication you are given. So just a container-based health center we want to position at various places. So we are saying that if you show up at the health center, polyclinic, or a CHIPS compound, or this makeshift container-based health center we are talking about, you should identify yourself. You may identify yourself with Ghana card. Identify yourself with your passport or your voter's ID. The reason why we are doing that is that we don't want other people to take advantage of this program. If you go to Aplau or you go to Elibo, we just walk in and out of our neighboring countries. So if you don't put in a measure that will also help this program to run well, you have other people benefiting and the indigents of this country may not benefit. So that is the reason. So it's just for you to hold your Ghana card or any identification and then you benefit. The other aspect, which is the national health insurance you refer to. You see, when you go to the health center, the CHIPS compound or the polyclinic, and you are taken care of, and they tell you that they have identified something, but that thing, you need to go to a district hospital, a regional hospital, or a teaching hospital. What do you need? You need a national health insurance to go there. Because at that time, you may not have money. So your health insurance is still in need, is still needed to take care of you going forward. Our plan is to make sure that we remove financial barriers. You don't have to think twice about money before you go to hospital. When that is removed, you have your health insurance, you can go to hospital. If it's the basic care, you go. At times you wake up, you are not feeling all right. It may be your BP that is worrying you. You go and then they check you. They advise you if you have to lie down some more for you to recover before you move on. There are a lot of deaths we record, avoidable ones, and that is what we want to do. We want to try as much as possible to bring to an end some of those needless deaths we've recorded. As you are putting in place measures to help your people, there will be some people who will also be in the way of the policy's progression. We will know this is a policy introduction. There is the sanction you have is the sanction every public service would be subjected to. If what you are doing is against the rules of engagement, it's clear. It means that you can't be around that area. You are an endangered species to the people. You are, what do we call, an enemy of progress. So you should be removed for somebody to. And we don't want enemy of progress in this particular matter. Because all of us as a country, we've identified that this is our problem. We want to deal with our problem. So you should not be. The minister warned that anybody, any person who stands in the way of this policy, it means that he wants the people of this country to suffer. He or she will be dealt with. So the implementation is not only us, it is you, the people of this country, who will help us. If you go and you find out that somebody is not helping, you will call our attention. We will be there to make sure that it works. Policy and monitoring mechanism we put together, we think that will help this program succeed. So this policy is actually being put under the health insurance formula. Normal every year in the healthcare, this is what you want to do. This is how percentage you want to do. This one has been put also on the health insurance formula. The clear money has been allocated for it. I want to be sure of the amount, and then I'll mention it. But there is an amount, I think it's 1.2 billion. I'm sure that is the amount we want to use on this project annually. So every year, if we are adding on for this phase, so if you are adding on, we'll still have another resources made available for the phase that will be added on. So for us, we look at the income tax, which is the health insurance tax, that levy, and then we look at subscribers levy. Those are the places that is where money comes into the health insurance fund. So that is what we are talking about. Looking at health insurance, whatever goes into the health insurance, the formula is captured. In the past, some money, about 40%, goes into a different fund. His Excellency the President is saying that don't put any money anywhere. Whatever comes to health insurance, keep it there and take care of all the health needs of Ghanaians. So that is where we are on that. Health insurance is not struggling. It used to struggle. Now, after the uncapping of the health insurance is one of the stable and solid social interventions we have in Ghana now. In the past, it was capped. Now it's been uncapped. The health insurance authorities now going around asking hospitals whether we owe you or not. We want to pay you. Do we owe you? That is what is happening. It used to be a different case, but now health insurance is solid. It's on its strong footing and it's working. You can go to any hospital and check whether health insurance is struggling. No. The subscribers are now waiting for us to even pay them. They come and ask, we go and ask them whether we owe them and then we pay. So that is not the case today. How is it a conflict? I just explained it to you. How can health insurance, which is taking care of your health from district to above, be a conflict of a free primary health care that is happening at the CHIPS compound, health center, and the polyclinic? Don't forget, as we speak, about 67% of Ghanaians are subscribers of this. So the rest of the people are not subscribers. So now we want everybody, because the aim is to achieve universal health coverage. So everybody, you go. Don't use money as a yardstick that I won't go to hospital. Don't use anything. You go to hospital because we want everybody to go through that process. For us to know our data, know what is wrong with Ghanaians, how do we deal with it, which measures should we put in place to forestall any health hazard in the country. So this is a good way to do. Every country, this is how they go about getting their universal coverage. So it's a good thing. We want everybody, every Ghanaian, to assist this program to succeed. That is the only way all of us can be safe. If some people, you are going to hospital, they know your health status, a group or a section of Ghanaians are not going, it is dangerous for us. It affects all of us. So let's encourage everybody to go to hospital for us to know what is wrong with us. Then we have a holistic data of a country called Ghana. And then if there is anything, we can say that this is the disease we have. Now we have a sentinel center across the country picking every disease that we have. So if the person is not going to the hospital, it means that that person's health status is not known by Ghana. You understand? So it is proper for all of us to go to hospital so that we have a database of the health needs of the people of this country. So it's important we are bringing this on board. Free will continue as long as we live in this country. Free has come to stay. Free primary health care is the way to go. This is how every country is actually um, trying to achieve their universal health coverage. If we don't do it, we are in trouble. Everybody must support this free primary health care because there is no other Ghana for us to go and live in so that they will take care of our health. This is the only place. So let's make sure that this free primary health care progresses without any hitch. I don't know where you live, but if you go to your villages, the only reason why people do not go to hospital is because they don't have money. It's because they don't have money. They sit in the house, they only get on leaves and then boil and then it's damaging people's liver. So we want them to go, and then the health authorities will take care of them and tell them what is wrong with them. Some of them may be even their BP, but because they woke up, they've not checked their BP, they don't know exactly what is wrong with them. So let's save our people. His Excellency the President mentioned that these equipments are going to be monitored, and if they are not being run well, the special purpose vehicle that is being developed for equipment maintenance from the regional hospital to teaching hospital. If the district hospital to the basic level are not maintaining, they are not putting money to maintain the equipment, what happens is that they will be rolled onto the special purpose vehicle. The special purpose vehicle is a vehicle that will maintain all the equipment in this country because we've bought a lot of equipment, they've broken down without any repairs. This particular one, you remember His Excellency was saying that every money you generate for, put some aside to maintain it. If you get some more money, if you put it aside, you maintain up to a point. If it's obsolete, you can buy a new equipment to put in there. If that is not done, we realize that equipment are breaking down, we are not getting money to. We just roll them over onto the special purpose vehicle that is about introduced for the teaching hospital and regional hospital, and then they take care of all our different needs in the country. Yes, it is the best. We want more of the tricycles. I don't know whether you have been to. I have gone on outreach across the country under the regenerative health program, and I can tell you there are places when you go to, you will not even be able to use the tricycle. So at times you even park tricycle and walk and cross rivers. There are places you go to without this tricycle. How do you move? This tricycle will help the people pack their what do we call vaccines, mosquito net, and the rest, and move into a community to work. What do you want for them? No, and I'm telling you that 67% are on national health insurance. The rest are not on national health insurance. We are using data. This is science and data. It's not just assuming. People are not on health insurance. They are not going to hospital. Those who are even on health insurance do not even have the will to go to hospital. So he said that people should go to them and make sure that they are fine. If I'm contributing to health insurance and then I don't go to hospital and the people are coming to me, am I not benefiting? Is the state not benefiting? Yes. So that's what we want to do. Let's not finish constructing road before we take care of the health needs of Ghanaians. That is dangerous. Health will go without road. This is what we've been doing. If you go to our farm plains, if you go to some of the places, Dambai, here, LT, you can't even go with motorbike. Some of the places when you are going, the the road has grown weeds already. So you struggle to even go to these communities. So these tricycles, they are there to help. And we've been using a lot of means to get to these people. In the past, we were using even doors, wooden doors, to carry people and cross. At times, we put them at our back. They are cross, we carry them to cross rivers. So if you have not followed the trajectory of our healthcare system, and you sit in Accra, Kumasi, and other places, you think that all is rosary and that is Ghana. No. We need to commend our health workers, our community health nurses, who go to these communities to work, who carry things at their back just to make sure that a child is saved a mother is saved. We need to commend them, not to mock them. If new tricycle is to save people, and we said it's not good, what is better? The walking. Sometimes we joke, we mock people, but not knowing that what we are doing will come to haunt us. So if these nurses say, okay, we won't come to your home, if you are laughing at our tricycle, how do we move? So His Excellency mentioned that about 2,000, if I had it right, will be part of the volunteers. But those who are already doing the work, the community health workers who are already in the system, will also be part of this work. The CHIPS compound we are building across the country would also be part. So it is a multi sectorial approach in dealing with this, as the container-based kiosk is coming to deal with other areas. You have the communities going, you have the volunteers also moving around. Equipment is coming on board. It is a rigorous work. We are not just going to relax to make sure that Ghanaians suffer, making sure that everybody receives quality of care. Yeah, so you are seeing the real delivery. It's not political slogan. This is real delivery. You have seen the equipment we've procured. You went to Tema again. You saw the container-based health center I spoke to you about in country. You've seen the motorbikes. You've seen the tricycles. So it is not only slogan. These are things that are materializing. They are happening in every part of this country. Work is ongoing. Distribution has begun. It is something that we have thought through. It is something that has gone through a lot of consultation. You know, we started stakeholder consultations last year. We've engaged various stakeholders, including journalists in this country, and we've come to the realization that what we are doing is the best and it will help the people of this country. So it's not a slogan, it's a policy well thought through for the benefit of the people of Ghana.